Hello, I am Dr. Satyaprakash Mahajan, consultant dermatologist practicing at Rudranshu Skin and Eye Care Clinic, Nashik, Maharashtra. Fungal infections owing to increasing population density, which leads to overcrowding, lack of proper social hygiene and preventive care, inadequate knowledge regarding these infections, incomplete treatments, quackery have almost led to an epidemic rise in the incidence and prevalence of these conditions. Dermatophytic skin infections or tinea infections or ringworm infections, which is a misnomer, are the most common superficial fungal infections presenting to a dermatologic OPD. One's vulnerability to these infections is an interplay of three major factors: the virulence of the fungus, the inherent host defense like a weakened skin barrier, and the weaker adaptive host response. These factors play a major role in the recalcitrance and relapse of fungal infections. Unless modified by improper treatments, these infections clinically are diagnosable by pathognomic signs of a circular or a geographically spreading itchy annular patch with a papillovesicular scaly or crusted border and central clearing. The patient usually presents to the OPD with symptoms of itchy enlarging patches, most often in the body fold areas. The most common sites are the groins and buttocks, although the lesions can occur on any other body surface area. When affecting the nails, it is labeled as onychomycosis. An easy to perform bedside test called KOH mount examination of the affected area skin scrapings can help one easily identify these infections when the clinical picture is not pathognomic. Being a contagious disease, one should be educated with the possible modes of disease transmission and how to adhere to proper preventive measures to help break the chain of transmission. The common mode of transmission is from direct contact with affected persons, animals, soil, or indirectly through fomites. The usual culture of sharing household items or soaking and washing clothes in a common pool, inadequate disinfection of the clothes facilitates disease transmission. Hence, it is wise to avoid direct skin contact or sharing items of an infected person to prevent getting infected. Also, instructions to disinfect the affected person's clothes by soaking them separately in hot water for 20 to 30 minutes and drying them in good sunlight or by ironing them should be advised. The infected persons should be advised to avoid repeated scratching of the affected area, keeping the body folds dry and ventilated, avoid tight fitting or very occlusive garments, remove any waste or body threads. In case of infections like athlete's foot, one should be instructed to avoid regular wetting of the feet, keep the web spaces dry, avoid tight fitting or occlusive footwear, inspect the nails to see if they are getting infected or look for color change or thickening underneath the nails. Since toenails grow very slowly, fungal infections of these nails take long time for treatment and hence remain a potential focus for relapse in the groins, especially when one is wearing undergarments that inadvertently touch the feet. Management of dermatophytic infections of the skin involve not only pharmacotherapy but proper counseling regarding the disease causation, hygienic maintenance, preventive measures to break the chain of transmission, importance of adherence to use the medication, proper follow-up and completion of treatment. Also, spreading social awareness to curb the improper self-medication, rampant quackery leading to abuse of topical steroid mixed preparations is the need of the hour. Hence, dermatologists, owing to their proper training regarding knowledge of cutaneous fungal infections are better equipped to manage these infections, especially when recalcitrant fungal infections are increasing day after day. For localized treatment-naive fungal infections, proper use of topical antifungal preparations with the rule of 2 advice, which is apply twice a day, at least 2 fingers beyond the active margins and for at least 2 weeks beyond clinical cure. For chronic modified or extensive fungal infections or involvement of nails is seen, preference to use of oral antifungals along with topical antifungal, preferably of differing mechanism of actions till clinical cure and even 2 weeks beyond is advisable. Of course, given the scenario of notorious recalcitrance and relapses seen in nowadays, a proper patient counseling and follow-up with due diligence in treatment and care by the dermatologist can help overcome this stubborn situation. I hope I have been able to give you an overview on common fungal infections and tips to prevent it. If you find such videos helpful or more such videos, to check out the website dermavidya.com. As a doctor, my advice for any skin and hair related issues is do not self-medicate. Please get in touch with an expert dermatologist nearby you.
For more such videos, visit or log into dermavidya.com.